Hi, I'm Lisa Graybill, and thanks to my colleagues here in Ohio for inviting me to come visit and talk to you all a little bit about what we've learned in Texas and what maybe hopefully any lessons you all can draw from that experience here in Ohio. I'm the legal director at the ACLU of Texas. I've been there for 6 years. Before that, I was at the United States Department of Justice in the Civil Rights Division, also working on prison and jail conditions cases. So I've got about 10 years of experience now working on these issues. People say everything is bigger in Texas, and unfortunately that also applies to the private prison industry. I was born in Texas in 1984 with the Corrections Corporation of America, which started managing a Houston processing center, and it has expanded like wildfire really ever since. As of 2007, Texas had the nation's highest rate of private prison beds and the highest number of people in those private prisons, 15,000 at that time. It has given rise to an incredibly powerful lobby, the private prison lobby, whose function is always to find more business, which means finding more people to incarcerate and incarcerate them for longer. That is what keeps that industry in business. It's not about rehabilitation, it's not about safety, it's about profit. Some of the problems that we've identified in Texas, some of the lessons we've learned or learning some of them the hard way, are that focusing on profit rather than on effective prison administration leads to lower quality of operations and poorer conditions for inmates and for guards. For example, cutting corners on medical care, which is a primary place that private operators like to try to save money, leads to more deaths due to untreated illness. It also raises public health concerns as treatable and communicable diseases are not treated. Examples include STDs, tuberculosis, MRSA, even chronic pulmonary kinds of problems, respiratory illnesses can really spread, and the lack of medical care endangers not just the health of the inmates, but also the folks who are working at the facility and the community in which the facilities are located. Private prison staff are paid less, they're less experienced, they receive significantly less training and supervision, and there's a much higher rate of staff turnover, all of which creates dangerous conditions in facilities that, again, put both inmates and administrators and guards at risk, as well as surrounding communities. Of course, I already mentioned some of the studies that show there are more escapes, more assaults, both inmates on staff and inmates on guard at privately run facilities. There's also more misconduct. In Texas, we've had repeated problems with sexual assault, with contraband, with drug smuggling, and all of this is because, or some of this is because, private prison guards are generally paid so much less than their municipally paid counterparts that they have a huge incentive to run contraband and to take money from inmates. Two facilities in Texas, Willacy run by MTC and the Central Texas facility run by GEO, have had drug smuggling operations run by guards break open in the last couple of years. There are also more riots and disturbances at privately run prisons because cost cutting has led to the poor conditions, which leads inmates to unrest. For example, one of the cases that folks have mentioned that we're currently litigating is we're representing the family of an inmate who died, an epileptic man who entered the facility epileptic. He was in for illegal reentry, which is a nonviolent immigration offense. He came in, his mother brought his epilepsy medication in, he wasn't given his epilepsy medication, he was inappropriately medicated over the course of a year. The medication that he gave him caused his gums to grow over his teeth, and he repeatedly seized in the general population, where his fellow inmates actually took pretty good care of him. But he was placed in solitary confinement for continuing to complain about the fact that his epilepsy wasn't treated, and he died alone in a cell without a buzzer after having been in solitary for a month. He was placed in solitary for punishment for complaining about the inadequate medical care. So we're currently litigating a case on behalf of his family against not only the private prison operator, but also the county where the facility is located and the Bureau of Prisons that placed him there. And we got into the case both to achieve some justice for the family and to try to change conditions at that facility, which are egregious. After this inmate died, inmates at the facility rioted and caused millions of dollars of damage to the county-owned property. And there's now subrogation litigation going on between the county and the private operator. So the costs to this county are mounting, and they're going to come out of it definitely in the red. Private prisons are not cheaper because state agencies have to clean up the mess when private prisons mess up and often bail out. RCDC, the riots at the Reeves County Detention Center that I mentioned, they had to call on the FBI, the local police department, the Texas Rangers, and firefighters. So there's reconstruction and cleanup costs. Like I said, there's insurance subrogation, and there are contract disputes now. So the costs are really shifted from the front end to the back end after the bad things happen. And obviously there's significant litigation cost as a result of these egregious conditions. Recently in Texas there was a $42.5 million verdict against Geo and Willacy in a case in which a National Guardsman who was in for possessing less than a quarter gram of cocaine was beaten to death by other inmates who put a lock in a sock while guards watched, laughed, and later destroyed evidence. The warden has actually been charged with criminally destroying the evidence of the videotape of the incident. So that's an enormous cost that is shifted again, not just to the privates, but also to the municipalities or the states that are contracting with the privates, because at the end of the day, the inmates are still in the custody of the municipality or the state. The last thing I would say is that private prison entities heroically resist efforts at oversight and transparency. We are currently contemplating litigation also against Reeves County and against Geo and the private medical provider who refused to turn over documents that they should turn over under Texas's Public Information Act. They have argued trade secrets and all manner of exemptions which are inapplicable, but we're going to have to litigate to get the information that would be available to the public for these facilities being operated by public entities. What we've learned in Texas, I think it seems like y'all have learned or are learning here in Ohio, which is that sentencing reform and depopulating the prisons of nonviolent offenders are the answers to prison problems, not privatizing prisons. They don't save money, they do cause harm, and I don't urge you down that road. So, thanks.
There are two points that we need to make. An effective criminal justice system is one that relies on proportional sentencing. An effective prison system is one that relies and depends upon a well-trained professional staff that increases safety and reduces recidivism rates. And offers programming. To the credit of ODRC, we have hit an 11-year low in our recidivism rate of 34%. And that was done because of effective programming, assessing an inmate's needs, and providing better training for the staff. None of that would be the case as if we consider and continue to entertain the idea of privatizing our prisons. Private prisons do not believe in a well-trained staff. They do not fund that. They do not believe in better programming or matching up inmates with better assessments and tools that would provide them with the rehabilitative skills that they need. That's not the case. Ohio is the 6th largest prison state in the nation, and there are some costs associated to that. In 2008, we spent nearly $200 million incarcerating low-level offenders who could have been charged under misdemeanors. We spent $200 million. In 2008, because we had 500,000 working-age ex-felons, we lost in our state employment output GDP $2.9 billion. So not only are we losing and sending people to prison unnecessarily, who could be better served with cheaper programming. For example, drug treatment, non-residential drug treatment is $6 a day versus the $26,000 that we're spending on incarcerating, again, low-level nonviolent offenders. But we're also losing in employment output. We're also losing in our tax base. These are the very detrimental priorities that we have put in place. And sentencing reform is not bringing in private prisons. Sentencing reform is undoing the bad sentencing laws that have resulted in this bloated population that we currently have in Ohio. We cannot